Welcome to another edition of the Inspired Stories podcast, where leaders share their experiences so we can learn from their successes and be inspired by how they've overcome adversity. My name is Anthony Codaspoti, and today's guest is Crystal Farmer, Senior Vice President and Chief Operating Officer at Augusta Health. They are one of the top community hospitals in America, recognized for patient-centered care and membership in the Mayo Clinic Care Network. They offer a wide range of healthcare services focusing on operational excellence, high-quality treatment, and compassionate patient experiences. Now, under Crystal's leadership, the organization has earned top marks for patient outcomes and expanded its clinical services while streamlining operations. She has more than 28 years of experience in nursing and healthcare leadership, including roles as Chief Nursing Officer at Augusta Health and other prominent hospitals in Richmond, Virginia. She is also a member of the American College of Healthcare Executives and the Virginia Organization of Nurse Executives and Leaders. Her dedication to continuous improvement has helped Augusta Health remain a vital resource for its community, providing care with advanced technology and compassionate service. Now, before we get into all that good stuff, today's episode is brought to you by my company, Add Back Benefits Agency, where we offer very specific and unique employee benefits that are both great for your team and fiscally optimized for your bottom line. One recent client was able to add over $900 per employee per year in extra cash flow by implementing one of our innovative programs. Results vary for each company, and some organizations may not be eligible. To find out if your company qualifies, contact us today at addbackbenefits.com. All right, back to our guest today, the Senior VP and COO of Augusta Health, Crystal Farmer. I appreciate you making the time to share your story today.
Oh, I'm so grateful that you asked me. This is a real honor, so thank you.
Absolutely. Let's jump right in. Crystal, what was it that first drew you into the healthcare industry?
I don't have the same story and journey as most people that go into healthcare, and they've known since they were a child that they wanted to be a nurse or a doctor and help people. For me, it was a little bit of a different story. I had a different career path in mind, and I got hit by a drunk driver. And so my career path originally was going to be going into the military. And we got in a car accident, and we were hit by a drunk driver, and I injured my back. And so I was not eligible anymore. And so then I thought, and this is right out of high school, well, now what? Because that was my plan. And I took a year off. I went to nursing, certified nursing aid school, and started working as a nurse's aide in a nursing home, and just got to see healthcare from a different perspective. But I also remember my mom being an office manager for a doctor's office. And the two nurses in there, they always wore white, and the way they talked to the patients, and I knew them most of my life. And so I started thinking back at, well, I want to be able to do that. I want to be able to talk to people and help people. And so I decided to go to nursing school. And my first day in nursing school, they load you up with the books, and they came up to my shoulder, and I thought, what am I in store for? But I have never looked back. Things happen for a reason. And I think my path was not supposed to be in the military. It was exactly what I'm doing now. I've never looked back.
When did it click for you? When did it feel right?
I think in my first semester of nursing school. And actually it clicked a little bit before that, because that's what made me want to go to nursing school, was being a nursing assistant and helping patients that couldn't help themselves, and seeing them in situations where they can't even lift a cup so they can get a drink when they want to, and seeing patients in this vulnerable state, and being the one that can make them more comfortable, or offer an encouraging word, or just have a conversation with them. When you're in a room, you're very isolated, and so I started seeing the power of nursing, even when I was a nurse's aide.
What was maybe the most formidable stop for you before getting to Augusta Health?
There's so much that's happened over 28 years sounds like a long time, but it doesn't feel that long. I think when I first became a CNO, I did not think that I was CNO material necessarily, and I had a leader that believed in me and really didn't give me a choice not to be, which I have to, one day I'll have to tell him how he's impacted my career. But
Do you want to offer up his name? Give him a little shout out here.
his name is Will. He was a CEO at Henrico, and um, I don't think he knew what he was doing at that moment, and how much it's opened up my world, but it certainly has, and so I appreciate his faith in me. But I
What
think
do you think he saw?
at that time, um, I was really at this point in my career of where do I go next? I was a director, I felt like I could do more, but my confidence was not great, and so I was really at probably the third or fourth crossroads in my career of what do I do now? Um, I mean, there's been many things over the years.
What is it that you think that CEO first saw in you that maybe you were having trouble seeing in yourself at that time?
Results. If, when people ask me sort of what's your reputation and at any organization that you work in, it's really around getting things done. I have very high expectations of myself and others, which is not always a great trait. But I do not give up. And I love being able to be creative enough in my roles to problem solve and not just do things the way everybody else sees it. So if I get a no, I'm going to figure another way to do it because maybe it's not this way, but it's this way. And I think he had seen me take a couple of challenging areas that I was in charge of and really turn them around into a place where people wanted to work, physicians wanted to put their patients there, and that was no small feat. And so I think he knew I was tenacious because where he put me for my first CNO role, you needed to be tenacious, you needed to be a good problem solver, and you needed to be able to connect with people. The hospital was very small. The census was around 30 a day, and it was not doing well. And they had a new CNO and a new CNO as well. And so between the two of us, it was in the red for quite a few years. And in our first year there, we were in the black. And it's because we did those things.
Did what things? What were you able to do to turn it
Connection.
around so
Mainly
quickly?
it's connection, but the hospital was at the bottom of the bottom for patient experience in the ED and inpatient. We did not have great employee engagement scores, so our employees were not having a great experience working there. Morale was very low. Our physicians did not feel heard. They didn't feel like they had a voice. And then our census was dropping, so physicians weren't admitting to us either. And so we had great staff, but how do we motivate? How do we say this is different? How do we invest in them? And, the best investment is time. So both her and I, we met frequently with the staff. I put in quite a few tactics around patient experience, and I can share that story about the things that we put in place, but it was really about connecting not just with our patients, but with our frontline staff and being vulnerable, honestly, for a lot of that. One of the things that that happened in my first role as a chief nursing officer is my mother was burned over 60% of her body.
Wow.
And this was in my first probably 6 months of being a new CNO. And I just, the hospital she was not in my hospital, but a hospital that was not far from me. And so in the evenings I would go and visit, and she was there for 8 months. So it was a long process. And during that time, she had all kinds of infections. She had catheter-associated infection. She had bloodstream infection. She had pneumonia. She had a blood clot. Just all sorts of different things. But what made a difference in that hospital visit and in that hospital time period that I take with me now to every role that I do, my mom was actually, she went into cardiac arrest, and while I was there, and the team really rushed into the room and started working on her. And even though I'm a nurse, I'm standing at the bedside, and nurse training goes out the window when you see that and it's your own family member. And in the middle of it, the nurse manager turned over what she was doing in the code to somebody else and came out and talked to me. And she said, I know that your relationship has not been great with your mom for the last few years. I know how she got here was not something you're proud of. My mom was addicted to narcotics, prescription medications, and she just wasn't an easy patient. And she said, we don't care about any of that. Right now in this moment, what I care about is, are you okay? What can I help you do right now? And we're going to take the best care of her. None of those other things matter, and you're right here where you need to be. And, it was just a few words, but it was the feeling that I was understood, that, people were not judging my mother for her lifestyle or judging me for our relationship. But in the moment, it was all about taking care of her, and nothing else mattered. And so I remember taking that back to my hospital as we were trying to figure out, how do we improve our patients' experience at our hospital? And I took it back to my nurse leaders, and I had to be very vulnerable. It's still difficult to tell the story now about all the things that I saw and the consequences of her just being in the hospital for a long time. But if I had to rate that hospital, I would have rated it great because of the human connection. Bad things happen. But that nurse manager coming out to me and then calling me later to check on me and give me an update on my mom. And then she made a point every time I came to the hospital to say, how are things going? And just really build that relationship. There was a human to human connection there that I knew that she understood. And
Wow.
so I took that back to my team of, I think what we're not doing for our patients is making them feel like a human, like we care about them, or their families, like we care about them. All healthcare providers, we go to school, we're highly trained, we know what to do. And so we save people's lives every day, but I don't get letters about saving people's lives. What I get letters about is how we made somebody feel why they were here. Or didn't feel while they were here.
Right.
They don't expect to be treated like family. They don't expect to really connect with a stranger in a hospital. And so we really worked on, the leadership team and I really worked on making sure that we were rounding on the patients, so going to see patients every single day, the nurse leaders, asking those questions. It's not just about how you feel today, but what's going on in your life outside of here. Are you worried about your dog at home? How can we help that? I heard today's your birthday. It's making connections to the human side, not just the patient or the diagnosis or the room number. And that was really the trick. I call it the secret sauce. It's not so secret, is it's just about connections. And we saw our patient experience go to the top.
How quickly did that transition happen
About 6
from the
months,
bottom? Six
less than
months.
6 months.
So it's incredible that you took this very challenging experience with your mother and the interactions that you had as a result, and it turned this light bulb on inside your head. It's like, this is what we're missing, where I work. How, when you brought this idea to the team there, how was it received? Did everybody agree with you? Oh yeah, absolutely. Let's start doing this. Was there some resistance?
Oh, there was certainly resistance, and the first resistance, which is normal for everybody, of, you're asking me to do another thing. I'm so busy. I'm trying to put out fires. You're asking me to do another thing, and it takes a good hour or so, if not longer, to see every patient on a particular unit, round on them, and have a meaningful connection. And so we practiced that. I went with them. I wasn't asking them to do something that I wouldn't do. We practiced rounding. We did a lot of training up front because for some people, that's not a natural conversation to have. We're so used to, in the medical field, of having a conversation about your health, but not necessarily a human to human conversation about just you. And so we did a lot of training up front. We did a lot of practicing up front. And I asked them, I said, can you just trust me on this? Just do it long enough. And if it doesn't work, then I won't make you do it. And within that short time, it was less than 6 months, when they started seeing the results of their patient experience and reading comments about how the patients felt cared about, like they were family, I didn't need to even ask them to do it anymore. I didn't need to tell them to do it anymore, because they saw that it worked. And it was the same thing with our quality metrics. I mentioned that my mom had a lot of infections in the hospital. And when you're in leadership, and you probably see this too, is sometimes you can be so metric or number driven. And I think I was starting, especially as a CNO, there's a lot of information coming at you, reports. And so then you just start thinking, okay, this number's in the red. We need to get it to the green. And what we forget sometimes is that behind every single one of those infections is a patient that we did harm to. And that's the way I look at it. Not intentionally did they get an infection, but they had something that they did not come in with. And so we handled, our quality metrics also went very high in the company, top percentile. And it was because we started thinking about patients as there's a patient behind every single one of these numbers. And if it was my mom, if it was your sister, would you do something differently? And my team came back and said, yes, we would probably do this differently. And so it was just a lot of those vulnerable conversations and sharing my experience.
And so obviously you took these learnings, these lessons, these experiences with you as you made other career stops, including to Augusta, or maybe they were already doing something like that when you got there. I don't know.
For Augusta, the patient experience has always been middle of the road, okay, not bad, but not always great either. It may not have stood out. I took the same things. The first thing that I implemented here with my team was nurse leader rounding on all patients. And that was a little bit of a challenge. Again, time is so hard to come by when you're in leadership or healthcare in general.
And change is always hard for folks.
There's so many things that happen in a day to a patient. You can't schedule those things. It's uncontrollable. That's why they're in the hospital. And so anyways, I did the same exact thing, created training and said, just do this for 3 months. Let's see how it works. And it was the exact same story, that the units and the managers that really took it seriously to go and meet every single patient and make that human connection with them, their patient experience scores went to the top percentile. And so it was just sort of another experiment. And so others, really started doing that as well. And it's just an expectation.
I think this is a really great story to share with the audience. And folks that are listening, I want to encourage you to sort of think about this in the context of your own daily lives, your work life, your home life, because this really highlights the importance and the value of genuine human connection. So you might not work in healthcare, maybe you're in an office setting, but what wonders would it do to your relationships with other folks when you show it a genuine interest? You ask them how they're doing, you listen for the answer. The next time you see them, you ask about that thing that you just talked about, right?
And we did the same thing with our team members. So if it works with patients and we only see them, this much a time of their entire life, we see their employees every day, 52 weeks a year. And so we did the same thing, and requested the same thing of what would happen if you sat down with all of your team members for 15 minutes a month and just asked how they were doing. What's going well, what's not going well, are there challenges, what can I do to help? And again, it wasn't necessarily about the job, but it was about making a human connection. And again, those were the areas where the leader really put the time in. 15 minutes a month is not much. And the return on investment on that time investment, you can't even measure it. but they felt cared about. So when we do employee surveys and the managers score high, it's because they felt cared about it. And that's what they say in their comments.
That's great. Okay, so Crystal, how did the opportunity to join Augusta first come about for you?
Yeah. So actually, it was those recruiter email cold calls. Those work.
Okay.
Sometimes I think the recruiter is like, maybe today's the day that somebody wants to look for a new job. And I wasn't not looking for a job. I was very happy in my role. I was already a chief nursing officer at my second hospital. I'd already been with the organization that I was with for over 20 years and not planned on leaving. But there were things that, I started to wonder as I got more comfortable in my own leadership style and in the leadership team, that I started to wonder, I'm not sure that I feel valued here every single day. And It was really just having time and experience in there that I thought, I wonder how it's done in different places. So to be honest, I happened to have like probably a very challenging week, and then I got that email, and I thought, where the hell is Fishersville, Virginia? First, I've been in Virginia all my life. I've never heard of it, it was 2 hours away, and so I reached out back out to the recruiter. I said, I would love to hear more about the hospital. And so on
Okay.
a whim, and really probably more for my confidence, I thought I'll drive up there and interview. But I don't plan on leaving. I'm fully invested. I have my retirement. And when I came to Augusta, I fell in love.
Pretty quickly, like on that first visit?
Yeah, I did. I hoped that I would have the second interview, make it to the second interview process. I interviewed, I tell my CEO all the time, Mary, I said, I was fully vetted. I interviewed with like 48 different people by the time all the interviews were done. And I left here after the second round of interviews thinking, wow, I really do hope I get that job. My daughter was still a senior in high school. So again, I was not, how's that going to work? Um, and so Mary gave me the call. But what was different for me, and where I felt like I could really do some good things here and feel supported as well, is when I interviewed with our board members. Actually, it was 3 or 4 of them that interviewed me, and I had interviewed with board members before, and when these board members interviewed me, they really talked about people. And one question was, patient experience is, what are you going to do about that? And tell me about how you did what you did in your current role. And so we talked about that, which I happen to be very passionate about. And then they said, also we're hearing in the community that our nurses aren't having a great experience here. Our turnover isn't great, but people don't enjoy working here all the time. And then I saw the nurses engagement survey, and it was in the 21st percentile. So 80% of other hospitals surveyed, the nurses were having better experiences than they were having here.
Wow.
And so we talked about that, things that I would do. And they didn't ask me about finance. They didn't ask me about all the regulations that we have to meet, because they assume I'm in this role. I've been doing it. I know how to do those things. But they really wanted to make sure that they were hiring someone that was focused on people. And just those questions alone, I thought, this is a different place. It's a different feel from top down. And then I interviewed with frontline staff, and they told me the same things. They were very open and honest, as staff usually are when they're interviewing a potential boss, about all the things that they feel like needs to change. And this was no different. And I said to them, you've been really open about the opportunities here and what's wrong, but why do you stay? Because many of them had been here over 15 years, and they all told me that it was because this isn't just a job for them. This is their community. So like one of them said, my mom just had a cath last week, but it was my friend taking care of her. And, I see my patients in the grocery store. And so it's really this community feel.
That's great. Tell me a little bit more about Augusta itself. How many locations? How big is this? Breadth of services that you provide?
Sure. I think our bed size are, so we're 255 beds, and that's a medium-sized hospital, but that's not very indicative of the size and the impact that we have on the community. So we have one hospital, but we are a health system. We have dozens of outpatient clinics, physician offices. We have a very large home health and hospice program. We have a mobile clinic. So we last year started, or 2 years ago, started taking healthcare to the community. And it really came out of COVID. But that's a great program. We go to 19 different locations with our mobile van and take healthcare to the people that need it the most. We have
Like, where are you going? Are these like homeless camps, or are these like churches, or
both.
like,
Yeah.
okay.
So we look at, the patients that are in our service area and where are those areas that need us the most. So they may have transportation issues. They may not have insurance. And it's beneficial to us, for them to get health care early, but it's also beneficial to them. And so we realized there's a lot of barriers to coming to the hospital. Let's take it to them. So it's
Who funds
churches,
that?
it's
Who funds that,
community
Crystal?
centers, it's homeless shelters.
Sorry for talking over you. Who funds all of that?
We do.
That comes out of your pocket,
It,
out of
it
Augusta
does. And
Health's.
so,
Okay.
but that's part of being a community hospital.
I was going to say, you guys are part of the
Yeah, we're
community.
part of the community. We're nonprofit. So much, we put 80% of what we make back into the community or into the hospital.
Wow.
And so we have a farm here as well. We have a working farm. We have a fitness center on site. So we have a gym and we have childcare. It's just a huge footprint in the community.
So you talked about one of the first things that you tackled when you got there was the whole human connection component. Get those employee satisfaction scores, the patient satisfaction scores up. Tell us about another project that you've wrapped your arms around and you're proud of.
A lot of it had to do with staffing in the beginning. If you talk to any nurse, we always feel like we don't have enough people, and there's a nursing shortage. So to a degree, that's also true as well. And but when I got here, one of the assessments that you have to make as a nurse leader is it we don't have enough bodies per se, or is it the team's not working together, or is it we're not scheduling right? Yeah. And so there's a lot of questions and assessment that you have to do when you're trying to figure out when people are saying staffing, we're short staffed all the time. And so as I dug into it, I realized, well, wow, we don't have enough bodies here. We don't have enough nurses here. And some of the ones that we were hiring because we were so desperate were not the right fit for our organization. We want to hire a particular type of nurse. And so I worked with not only with my leadership team of saying, I want us to identify the type of people that want to work here, that we want to work here. So what does that fit look like? And we stopped hiring what I say bodies, and making sure that we hired the people who want to be here for the right reasons. And so that made a huge impact in our turnover. Some of the other things that had to do with staffing was our reputation in the community. So we have a lot of nursing schools around us, and they bring their students here to do clinicals, but those students weren't always having a great experience here. They might have been mistreated by the nurses or the physicians. Well, that's where we're going to recruit from. And so, we had a lot of conversations. I met with all the schools, all the nursing school leaders, and said, I'm sorry for what's happened, but how do we move forward? How can I, make these relationships stronger and support the students and what they're doing? And so we did a lot of work about making sure that students felt good when they worked here. And that also helped us recruit tremendously because they felt like they were part of the team, even as just being a student. So they would apply afterwards. We also started a branding campaign, a nurse branding campaign. And that really talked about, if you want to be a nurse here, we have a L&D unit. We take care of you from birth all the way through your life cycle of any kind of nursing that you'd want to do until your death. because we have a hospice unit, and not every hospital can follow a patient's journey all the way through their
Mm.
life. And so we talked more about what it's like working here and the opportunities here. And so we just built a brand for nursing. Um, and so our turnover, where our recruitment numbers went up, and they continue to go up every year. And our turnover during COVID was about 32%, and now we're down to 14%.
Wow.
And so that's just through hard work.
Once you find somebody that fits the mold, they're there for the right reasons. How do you hold on to them? How do you keep them there?
It's just as important. And I learned very early here, because I put a lot of attention on, we need to recruit, we need to recruit, we need to recruit, because we just didn't have the sheer numbers to take care of patients. But during focusing on recruit, I had a nurse that had been here, I think 25 years. And I did a lot of town halls to explain what are we doing to get the word out. And a nurse that had like 25 years experience came up to me afterwards, and she said, it's great that you're recruiting and we're building our numbers, but what are you doing for the people that have been here? And I thought, that's a really good question. And I was so focused on recruiting, but I'm not going to keep those people that I'm recruiting if I don't figure out the retaining part. And so that's when we started really talking about, again, making those human connections with leaders, making sure our leaders had the right training. How do you know how to be a leader? What skills do you need? It's not just because you were a great nurse at the bedside. You need to make sure they have the skills and the tools to do their job. We talked about benefits, and we talked about what sort of, if we were giving a sign-on bonus, for example, to a new nurse, let's say we gave them $5,000 sign-on bonus, then what were we giving for our team? And so if a nurse referred another nurse here, then we would give that nurse $5,000 too, as a incentive, and so we did a lot of these little things. There's a ton of tactics that we did, but it was really focused on meeting the needs of the people that we have. One of the other areas is, and it's very challenging, I think, in all areas, is all the generations working together. And so what worked for a baby boomer is not going to work for a millennial or a Gen Z. And so we really had to open our eyes to, it's not a one size fits all. It's really the things that Gen Z and millennials have wanted is career paths and growth and development. And what does that look like? And that's very different than some of the other generations of nursing. And so we also made sure that we didn't have this menu of one size fits all, that there was really truly things that we could do.
Mm. Crystal, during the middle of COVID, you decided to get your pathway to excellence designation. What is that, and why did you pursue it?
Pathways to Excellence is similar to a magnet. It's the same company. And it really lifts up the power of nursing, and the voice of nursing. And Pathways to Excellence is really focused on the practice environment of every nurse, no matter where they work in the hospital or in a physician's office. And they want to know that we have the support systems and a positive environment for them to work in. And it takes a little while to build that. And there's certain areas that you have to, in order to build this positive practice environment, that you really need to execute on these particular things. And so I decided during COVID, even though we were already stretched thin, I think this is what we're going to need to start moving out of crisis mode into this is normal life. And it was a way to distract from what we were doing. But it was an entire team decision, because it does take a lot of time. And it is going to take away from some of the things that they had to do. And so I set the nursing team down, and also the other hospital leaders down, and said, here's what it's going to take. Here's the time that it's going to take from everybody. Can everybody get behind this? I know we have a lot to do. And every single leader in the organization had a vote. All my nursing leaders had a vote. And they all said, yes, we want to do this. So it took us 2 years to really meet all of the requirements to meet pathways. Once you meet the requirements and you've documented those, you send it to the ANCC, and they accept your document. So you have to have examples of every single thing, all the requirements, and a real example about how we met this thing. It also had to be written by frontline nurses. So it was not leaders that were writing these things. It was frontline nurses giving examples of how we've met this. After they accept our documents, then they do a survey of every single nurse, and it's sort of validation. So we got your documents, but are you really doing this? And so they anonymously survey all the nurses, and we have to get a certain percentage in order to be designated as a pathway to excellence. And it was just what we needed to start coming out of COVID, focusing on the things that created that positive practice environment, like rounding, like leadership development, career pathways, all the different ways they can grow, certification, pay. Those are the things that nurses care about. And we had a laser focus on those. And it was the best thing we could have done.
Crystal, say more about that experience of coming out of COVID. COVID was hard on everybody, but probably no harder than it was in your environment. What was the vibe there like, and how helpful was this Pathway to Excellence program?
It stopped me if I'm rambling. In the middle of COVID, where things were changing literally every 15 minutes. Do you wear a mask? Do you not wear a mask? Do you, wear full protective equipment? Do you have to have a respirator? There were just all sorts of questions coming out. And this was even before the vaccine. And a lot of healthcare people thought, this is probably just a bad version of the flu. And we were all used to going through flu season. So we really thought this would probably be over in a month or two. And it wasn't, and it got worse, and patients died, and it was really hard to be a nurse at that time. Things were changing. You didn't have all the information. Social media didn't help either, and all these opposing views about things. And in front of them, they were seeing patients die like they'd never seen before. And we had to set up special units. They had to wear extra equipment, and it was just really difficult. And so when you go through something like that for an extended period of time, you really start going through burnout. And I call it caregiver fatigue, where you're so busy taking care of everybody else that you've become immune to your own needs, and sometimes not sensitive to others' needs because you're in this environment all the time. And so it created a lot of burnout. And so I felt like we needed to start really focusing on how we were going to prevent burnout, which also would have helped us with turnover. And so for me personally, I go back to the things that worked for me, and when a big change needed to happen, and again, I needed to go back to being vulnerable with my team. And because I also felt burned out, I also felt like, I'm not sure if I'm the right leader to see them through this, is having, again, questioning my own abilities to lead through this, because I've never been through this before, and I didn't have all the answers. And, sometimes all I could do was sit and listen, but I didn't have solutions for things. And so that really bothered me. Again, at the same time, having being burned out myself. And so I started thinking, I think that I cannot be effective here anymore. And this is my own wording. No one told me that. My boss never, she's always supported me. But I started feeling like I don't know if I'm giving them the right things. And I started questioning, maybe I should leave so someone else can do a better job of just helping with this burnout. And I had a nursing director come to me right at the moment where I really needed to make a decision whether I was going to stay or go. And she didn't know that I was internally dealing with this. And she put a letter on my desk, and it said, I know that you focus on us and the front line so much, but, I want you to know that I see you. And it still gets me emotional, that I see you, and that I appreciate the things that you've done and the time that you've spent with us. Even if you don't have the answer, the time spent and just talking through this has made me be a better leader, and and thank you. And so after seeing that, that was sort of that I needed to hear that. Even leaders need, that positive reinforcement every once in a while, and not everything, just because things aren't great. I mean, no one can control COVID. It doesn't mean that we're not doing well as a team, or that we're not close. And so I just disclosed to my team, listen, I'm feeling burnout too, but this is not the way where we're going to stay. And I had to be really open and honest with them.
And you chose to be open and honest with your team after you had received this letter.
Yeah.
Okay.
That, I was also feeling burned out and questioned my ability to lead them and to get them out of burnout. And, they were afraid to express some of the things that they were feeling, because I had tried to stay, very professional, and everything's going to be okay, and we're going to get through this. And that's called crisis leadership. You can't fall apart. And I realized that they needed to see the human side of me, where I was struggling just as much as they were. And the only way that we could get out of it is if we supported each other. And the leaders really came together, and we started holding each other accountable for not working late nights, not sending emails late at night, and taking your vacation, and just doing things to have a better work-life balance, but just opening up that conversation to my leaders to say, I understand where you are, because I'm there too, but how do we get out of it? I think it really impacted quite a bit of leaders.
It sounds like you struck a really critical balance at just the right time there, right? You can't show up to work, sobbing every day, because like you said, crisis mode, like, you got to show up and get stuff done. But at some point, being too professional, too rock solid, is making everybody else alongside of you feel like, what's wrong with me?
Right.
Because I don't have that same confidence that Crystal is exuding. And so then when you can kind of pull the curtain back and say, listen, here's what's really going on inside of me, they're like, oh, thank goodness.
Exactly.
Me too. Let's come together, give each other a hug, and, how can we make this better and move on? Yeah.
Yeah, that's exactly
powerful.
how it happened. And, some people could move on, and we mostly moved on as a group. Our nurse leader engagement improved by memory, over 40%. We were really low, and they took just a nurse leader engagement survey. And when I saw it was so low, I'm like, yeah, I'm feeling the way they are. And how do we get to it together? And so we use that as our starting point. And then we just did another survey last year, and it's more than doubled, what it was when we took that during COVID. And so I know that we're doing good stuff.
Yeah. Crystal, I want to hear you talk a little bit about blame culture that used to exist in the hospital system. What does that mean? Why is it no longer the problem it was?
Yeah, I think, it's one of the reasons why I when I was called on to be a leader, it's one of the reasons why I said yes. And, when things happen to patients or to other people, so I'll just use a fall, for example. If a patient falls in the hospital, the way it used to be when I was at bedside is the first question that you would get from a leader is, why'd you let your patient fall? And so immediately, one, you're on the defense, and two, you feel like you're a terrible nurse. And those things had happened to me, and I didn't let my patient fall, but I also can't be there 24/7. And so you put all these things in place to try to prevent it, but sometimes it's not 100% foolproof that it's not going to happen. And at the time that, I was blamed, I felt like blamed. I thought, again, this is early in my career. I'd only been a nurse for about 5 or 6 years. I thought, okay, well, they must not think I'm a good nurse. If I let my patient fall, and maybe I should be away from the bedside, and just really blame myself for a long time. And then I decided to go back to school to try to understand maybe I don't understand how things work, and how can I not let those things happen to my patients. So I decided to go back to school thinking I would have the answers to those questions. I want to be a better nurse. I don't want bad things to happen to my patients. And, what I learned out of school was, it's all about how the organization or how this particular leader looks at errors, medical errors, medication errors, things that happen. And the old school way was blame and shame and make you feel bad. And the way it should be is, okay, Crystal, your patient fell. Let's go back through this timeline about what happened, and are there things that we could learn from this? So, for example, in my situation, the patient had what was called a bed alarm on. So it should alarm when the patient comes out of bed. It didn't go off. So when we looked back and sort of did a root cause analysis of, well, why didn't they go off? It didn't give me enough warning. Well, it's because there was a weight limit on it, and my patient only weighed 90 pounds. In order for it to feel pressure, the patient needed to weigh 120 pounds. And so that's what we should be looking at. We should go back and say, let's go through the situation. Let's look at our policies or what we're doing in our policy, the thing that we're really doing. Let's go looking through the equipment. Let's figure out how we can prevent this from happening again. And that's proactive. That's a culture of safety. That's a no blame. Nurses
It's much more constructive.
Yeah, it is. And we've prevented other things from happening because nurses feel comfortable coming forward and reporting, hey, this happened. And so we dig into the situation. It's less than 1% of the time that it's actually a person issue. Most of the time, it's an organizational or policy issue that we just haven't dug into to find out why these things are happening.
What was the catalyst over the years to sort of spark this change?
The catalyst for me really thinking about how, errors at the bedside, again, just use that when there's things that happen in healthcare, no matter if it's a bedside or not, and how those people are treated. But as a leader, I wanted to understand that more because it does have a huge impact on somebody staying in healthcare or leaving healthcare and how they see themselves and making these errors. Over the years, there's been so many examples of when we talked about something or something was reported and we fixed it and no more errors happened. And it was really about nurses having a voice and into the work that they do. And they know how to fix things because they're at the bedside. Just listen to them. They're at the bedside. They know how these things work. They know how it doesn't work. And just listen.
I understand you've got two daughters, either in or entering the healthcare field. How do you feel about that?
I am so incredibly proud of my daughters. My oldest, and they'll probably both kill me for talking about them, but I talk about them a lot. They've influenced my career a lot as well. So my oldest is 26 and she's a nurse. And she's currently in an ICU unit. And she's been a nurse for about 4 years. So she went to nursing school during COVID. And, listening to her experiences during COVID really opened up my eyes to the experiences that my nurses might be having here. So when she would tell me about things during COVID and how she was training, I also understood when people graduated during COVID, they didn't get the same training that I did because it was very limited about what they could do during COVID. So she helped me open my eyes about some of the challenges that new grads might be having. But I would come back to my hospital and say, I just heard this from my daughter who works in a totally other system. Is that happening here? Could that happen here? And so again, it helped with those conversations and really being in tuned with the front lines. And so she's, even after she became a new grad, finished nursing school, became a new grad, one of the first times that she called me, and I just knew, she called me crying and I thought, oh, she probably just had her first patient pass away. And that's not what it was. Because we all feel a certain way, especially with your first patient. And well, with every patient, but in particular your first one. And I said, what's wrong? And she said, I just had a patient really talk poorly about me, and I overheard him talking to the other nurse, and I worked with him all night long. I was in his room all night, and just the lack of appreciation, the inability to call her names and to talk about her body style, her body type, just broke her spirit as a new grad. And so I came back to my leadership team and to my frontline nurses and I said, is that incivility happening here? And yes, it was. And so it opened up a whole new world to talk about violence in the workplace, the incivility that's happening, and what tools and resources do we have to make them resilient, to deal with these sort of things. And so my daughter has certainly taught me a lot, but I'm not going to let her know yet. And then my youngest, she is graduating from St. Louis University with her MHA. She got her MBA last year, and her dream has always been to be into healthcare leadership and population
She's
health.
had a good role model.
Yeah, health equity and population health, and to be in leadership. And she's done so many things the right way to get there. So now, actually, this month she'll be graduating in 2 weeks. She'll be looking for a job in healthcare administration, and I worry for her because just the state of things in healthcare in general right now, it feels like it's on a shaky ground with, all the policy changes and payment changes that are having how we get reimbursed for the care that we provide. It feels really unstable right now. And so I worry about her career and the things that she'll have to deal with, that at least we're a little bit more stable for me.
Yeah. Crystal, the next question I want to tackle, I wonder if we've already hit the topics. I always like to ask my guests about a serious challenge that they've overcome and how they got through it and what they learned. You've already touched on some. You have another one that you'd like to explore, maybe go a little bit deeper on one we've already mentioned?
There's, I'm going to answer that in a roundabout way, hopefully not rambling way. At Augusta Health, one of the things that we do is a new leader orientation. And our director of organizational development about 2 years ago asked, hey, we'd really like to understand your career path. And we'd like to have some of the leaders come and talk to the new leaders about how they got where they are, but what were those defining moments in your career that made you think twice or something changed, and the highs and the lows. So it's on, ideally you'd put a timeline together and your career progression is like this. And when you look at mine, it's up here. I had some highs, I had some lows, and it's just sort of like that because that's life. And so I probably have quite a few, my mom, being in the burn unit, that was probably one of my lowest points, but it became the highest because that's really what motivated me to do better for our patients. And, having children was a high point, but I also realized, soon after having children that I couldn't be a nurse 24/7. I'm always a nurse, but I also needed to make sure that I had enough reserves, emotional reserves when I got home to take care of them and to be emotionally and compassionate for them. And it's easy sometimes to give that all to your patients and not bring it home to your family. And so I had to make a career choice then of, I probably should go somewhere else that doesn't drain me so much emotionally. At the time I was working in hospice care. And so there's been lots over the years. I think COVID, that was probably the biggest that I've had next to the situation with my mom.
What have you found as a source of strength or someone or something you can lean on during the really hard times?
Just by the nature of who I am, I go internal, and it's not a great coping mechanism. And you learn the older you get that you can't do it by yourself. So my husband has been fantastic, and knowing when those times where I'm really inside, and so he's really patient and waits for me to start talking about that. But I've really had great support systems, And that's really, it sounds so cliche, but it's really been those support systems and letting me figure it out in my time, and then reaching out when I need that help. My support systems have always been there.
Are you part of any peer support groups? Some people call them masterminds or networks of folks who are in similar positions within other hospitals that you can kind of talk with and support each other.
Yeah, that's been a big part, and that would be advice that I would give anyone at any point in their career is build your network. Build your network, and you've got to have people that have similar roles to you, sometimes just as a sanity check, and to say, are you dealing with this? Or how have you dealt with this in the past? Or is this weird? But I have a number of chief nursing officers that I've been very good friends with. A couple of them have been my mentors. I've built a really great network that I can call any of them, and we can call each other. And during COVID, we were always on the phone with each other. But also reaching outside of nursing has been very helpful. So, I have mentors that were CFOs and COOs and understanding that world. But I also think that the team that I work with and in my hospital right now, the administrative team, it will make you or break you. And so we have such a great team that we really support each other in the good times and the bad times. And some people are so intuitive without you saying a word. They know something's happening. It just happened today. One of my colleagues came up to me and said, "Are you feeling okay?" I'm like, "Oh yes, I'm fine. I'm just tired." And she said, "Well, I wanted to check on you just to make sure because I was reading something different." And I'm like, "Oh no, I'm just distracted." And I was fine. And surrounding yourself with people like that. But I do have professional networks. I have nursing leadership networks. I'm a part of the American Academy for Healthcare Executives. I've built some great friendships there. But network.
What advice would you have for somebody who's in a position of leadership? Maybe it's, within healthcare, maybe it's not. And they're like, yeah, like I could really use that. How do I even get started? Like, how do I build my network? How do I find that support group?
I was lucky enough when I worked for my last company. It was a very large company. Um, and so you could just pick up the phone and call another hospital that was in the same company. And coming to Augusta, we're independent, so we're not part of a system. So I really had to practice on looking for those things. I think joining a nursing leadership organization is probably the first thing that you need to do. But then one of the wonderful parts about being part of the Mayo network is that now we have the resources, and I can call Mayo and say, "Hey, who's doing this right now? Which hospital, which CNO, which COO are you that I can talk to about this?" So that's been the fantastic thing about joining the clinical network there, because we have resources. I think the professional organizations are always where to start. Conferences, really taking advantage of going to your professional conferences. That's where all the one-to-one connections happen. And if you're in the same session, obviously you have the same kind of interest right there. And so just start talking there.
What does it mean to be part of the Mayo Network? What does that get you access to?
It gives us access to all of the other organizations that are in Mayo. So, Mayo has their flagship hospitals, but they've opened it up to other independent hospitals joining so that we can have a clinically integrated network. And so for us, how that's really helped us is, maybe there's a specialty that we don't have here. And so we want to call someone that's in the network to say, "What do you think about this?" Or sometimes our patients want a second opinion. Or Mayo is also known for their fantastic research and education that they provide. So all of our physicians have webinars and all sorts of education available right at their fingertips. They don't even have to go looking for it because Mayo's already done that. They have a lot of best practices that we can just tap into. For nursing, we've used their nursing network for best practice. So there's a CNO group as part of Mayo. And Mayo hosts a couple get-togethers every year for the CNOs just to talk about what are we dealing with. And so there's lots of education, lots of opportunities for clinicians to talk and work on projects together. It's just been a fantastic experience.
I want to talk a little bit more about community. You mentioned a lot about how you guys are part of the community. You have these health vans that go out, to churches, homeless camp, different places to provide free health care for people. The people who work there, they interact with their patients. They see them at the grocery store, at church, et cetera. What is like more formal kind of community outreach look like, aside from what you've already mentioned with the traveling health vans?
So we have a whole network for community. We have a community partnership that we've put together. So in partnership with large employers, other community-minded businesses and organizations, and we bring that entire group together and we start talking about what would be most impactful for our community. So is it investing in this, or a grant for this project for the YMCA, or something for the homeless shelter? And so that I feel like we're the gatherers of people, and we're all here for the same reason, but many times we're the facilitator of all those community groups working together. So not only is the organization itself doing things in the community, like I've already talked about, but we're bringing the other community partners together as well to do those things. And there's so many different things that we impact. Like I mentioned, our farm. We have our own farm. We grow produce there, and we deliver that produce not only to our patients who have food insecurities. Once we've identified them, we make sure that they get those vegetables. We also use it for our diabetic education, and we teach them how to cook healthy, and that's just an offering to the community. But we also deliver food to the food pantries in the area, so someone doesn't have to be a patient of ours to be impacted by the work that we do in the community. And so the food pantries, rely on that produce as well. And that's just one example of things that we do that, it's for the health of the community and for the benefit of the community. It's not because we're making a dollar off of it.
Mm-hmm. I like that. Crystal, I've just got one more question for you, but before I ask it, I want to do two things. First, I'm going to invite all of our listeners to go ahead and hit the follow button on their favorite podcast app. We want to continue to get more great interviews like we've had today with Crystal Farmer at Augusta Health. Crystal, I also want to let people know the best way to get in touch with you or to follow your story. What would that be?
Probably the best way would be on LinkedIn. It's just Crystal Farmer, COO at Augusta Health, and search for me, and feel free to send me a message. I've done a couple of presentations before, and that's the best way for people to just send me an email, and I'm happy to connect. I'd love to connect. The best part of my job is when I get to do things like that.
Well, and I understand that you actually made a LinkedIn post earlier this month. This is or actually it was last month, April 2025, that you were particularly enthused about. You want to give voice to that?
Yeah. So I just happen to love April Fools. I have no idea why, but I just always do. And now that my kids are grown, I can't do jokes on them anymore because now they know all my tricks. And so April Fools is coming up. We had a leadership meeting coming up, and I love to infuse fun and joy into our leadership meetings. Everybody hates a staff meeting because you sit there and listen, and even the most interesting ones, if you're not infusing fun and connection, if you don't laugh in some sort of leadership meeting, really you just leave feeling like now I got a whole lot more work to do. It's about building that connection. And so I had a partner in crime, our nutrition director, and between him and I, it took 5 minutes. We used ChatGPT. We made up a new menu for our cafeteria and told our key leaders that, we needed to support healthy eating and that we were going to go 100% vegetarian in our cafeteria. And our cafeteria is known, like people come in from the outside when they're not a patient just to eat at our cafeteria. So we have very good food. But going 100% vegetarian would definitely be a change. We have cows across the street. We grow beef here. And so it was a good trick. And people are still talking about it. And that's the kind of connections, like the shared stories that you have with your team, the shared jokes, the inside jokes. Those are great for building a team connection and purpose, but it's all about bringing joy back to work.
Well, we'll find a link to that post as well as a link to your own profile and make sure we include that in the show notes. Crystal Farmer, I want to be the first one to thank you for sharing both your time and your story with us today. I really appreciate it.
Thank you for the opportunity. I really appreciate it.
Folks, that's a wrap on another episode of the Inspired Stories podcast. Thanks for learning with us today.